Hi everyone. Our topic is on spleen. What is spleen? It is a secondary lymphoid organ. It comes under the reticuloendothelial system. Now we can go to its anatomy. In spleen there is a rule called Harris dictum rule, which contains certain numbers 1, 3, 5, 7, 9, 11. The 1 indicates its thickness 1 inches thick and 3 inches breadth and 5 inches length. The 7 indicates its weight 7 ounces. It equals to 80 to 300 gram, and 9 to 11. From 9th rib onwards till 11th rib it is located, and the 10th rib, 10th number. Spleen is located in a longitudinal axis. That axis passes along the 10th rib. That's why that 10 indicates. Okay, what is longitudinal axis? See, basically the spleen is located in some angle. See, this only. First, it will be directed downwards, then forwards, then laterally. See here, this is your spleen. This is your spleen. In case of discussion, you have to hold the spleen in left hand only. This is your spleen. First directed downward, then forwards, then laterally. This is the position of the spleen. Okay. See, I have drawn here, right? Next, it has two borders, superior, inferior, and there is a border called intermediate. If we can call, but mostly two only. It will be round, so we cannot say it as border, right? Two poles or two ends. Poles can be called as ends also. Anterior pole and anterior pole. See here, this is its axis. Anterior pole is located as lateral, right? Posterior. This only anterior, okay? It is located as lateral. This one is posterior, that is medial, right? So anterior pole is called as lateral and posterior pole is called as medial pole. Okay, two surfaces. This surface is called as diaphragmatic because it is covered by diaphragm and it will be smooth. This one is visceral, okay, and it will be somewhat rough, like two surfaces. See here, then angles. There are two angles, anterior basal angle and posterior basal angle. This is anterior basal and here somewhat posterior basal angle will be there, okay. In case of splenomegaly, we will palpate the spleen. That method is called Castell's method. Castell's signs, okay. Castell's sign. In case of splenomegaly, we will be moving from right iliac to left hypochondrium by rotating our hand, okay. While in case of splenomegaly, first we can palpate one organ, that is what anterior basal angle. It will be hitting our hand, hitting our palmar surface. So it is called as clinical basal angle. And which is called as clinical basal angle of spleen? Anterior basal angle. Okay. Then side shape. It will be like oranges are there, no, like that wedge shape. If in some spleens, the colic impression will be somewhat having prominent extension. Like if it is there, we will call it as tetrahedral shape. Okay, ligaments of the spleen, very important. There are four ligaments: gastrosplenic, lenorenal, lenophrenic or phrenico-splenic. See, leno means spleen only. Lenophrenic or phrenicosplenic. Phrenicocolic or Hensing's ligament, also known as Hensing's ligament. See here, from the stomach to spleen, the ligament extends, which contains short gastric artery and left gastroepibolic artery. Okay, two important contents. Then lenorenal, from spleen to kidney, it contains splenic artery, highly tortuous artery, and tail of pancreas. Okay, which will be hitting the hilum of the spleen. Lenophrenic or phrenico-splenic ligament. See here, the diaphragm is the no phrenico diaphragm, which will which will be suspending the spleen as a organ like this, in order to hold it. That's why we are calling this. It is a suspensory ligament of spleen, phrenico-colic or Hensig's ligament. It will be giving a support. It is not attached to the spleen. See here, phrenico-colic, diaphragm to intestine, diaphragm to colon. So from right colic flexor to diaphragm, it just like this it will be there, or like this, like a slanting it will be there. Over it's the spleen lies. Just so it is called as sustentaculum lentis. See here, this is gastrosplenic. Two contents, what are they? Short gastric artery and left gastroepiploic artery. See here, this is Leanorenal, splenic artery, tortuous and pancreatic tail. See here, this is diaphragm and this is phrenico-splenic ligament. It is holding like a rope, right? So it is called as suspensory ligament of spleen. This is phrenico-colic ligament. See, it is not attached to spleen, but it gives a support. So it is called as sustentaculum lentis. Next, functions. See here, the spleen can undergo regeneration even we are removing some part. Then, in case of embryo, it acts as an organ for erythropoiesis. Spleen, liver, yolk sac, everything acts, right? It is covered 2/3 by ribs and 1/3 by stomach. Clinical aspect, applied anatomy, autosplenectomy. See here, in cases of severe starvation and uncontrolled diabetes, the spleen can undergo autosplenectomy. The size will be reduced and it can disappear also. See here, even without some organ, one person can survive it. What are they? Spleen and gallbladder. Notches of superior border. I have to say. See here, superior borders will be there. Borders there, no. It has many notches. Okay, it has importance, I would say. It has one importance. See here, those notches tells about lobulated development of the spleen. In case of in embryogenesis, the spleens are developed as lobule and then it is attached. Then it is grouped. Next, spleen and coli. What is spleen and coli? Accessory spleen found in some other organ. In some people's where also we can find, but most commonly it is found in hilum and gastrosplenic ligament. Okay. Splenomegaly. Most of the anemias and many conditions will result in splenomegaly due to ineffective erythropoiesis and hemolysis, increased hemolysis, which can enlarge the spleen can be enlarged max 3 times of its normal height, normal size. Palpate. Okay. How to find splenectomy? There is a sign called Castell's sign. We have to use our palm or surface from right iliac fossa to iliac region to, by rotating our palm, we have to reach the left hypochondria. There we can feel the clinical basal angle, that is anterior basal angle at our palm. Okay, it indicates that if it is below hypochondrium, the spleen is enlarged. Why the spleen is moving like this, not moving downwards, it is moving like opposite side, because as the ligament is supporting in downwards, right, so it cannot move down, right. In right side it has no support, so it is moving on that side. Blood supply of spleen. See, splenic artery. This is the hilum, which is penetrated by first splenic artery, highly tortuous splenic artery. Below that, the splenic vein is below the splenic artery. That is, the splenic artery lies above the splenic vein. Okay, splenic vein will be forming portal vein with that superior mesenteric. There are certain impressions important. See here, this is created by stomach and below colic, right? Colon. At this pancreas, tail. I said no, tail. Here only gastrosplenic ligament will be there. And posteriorly by kidney, we know renal. This is the intermediate border. I said no, somewhat round like, but it is not a border also. Looks like border. Splenic artery, tortuous. Okay, development. See here, as I said earlier, it has a low bladder development. Each mass has own blood supply. Every small particles has own blood supply, and after fusion also they have separate circulation. There is no anastomosis or anything formed in between them. If there is a block of one branch of splenic artery means also that infection will be to certain lobe which is supplied by it. Okay. Development. This is secondary lymphoid organ. So the lymphoid origin comes from mesenchyme. The capsule structure and reticular endothelial systems. From the mesoderm, from where? That mesoderm is from dorsal mesogastrium of the stomach. Thank you guys. That's about spleen, and spleen will be kept for a discussion. It will be very easy organ. Okay, thank you.